Very good morning, everyone. I welcome all the office bearers of Maharashtra State IP and AHA Nasik. I welcome all the delegates and all the speakers who are present here for a very, very important session which has been scheduled today. In the beginning, I would like to request Dr. Atul Kanikar sir, who is a renowned adolescent health pediatrician from Nashik and who is a pillar of the PATH program, which we are running successfully since last 1.5 years for general pediatricians. Over to you, sir.
Yes. Namaskar, Suprabhat, and good morning. I'm still seeing Trupti Mahatma's beautiful face, but I would like to see other faces also. Somehow, Pallavi madam, can you help me?
तर तुम्ही हे गॅलरी व्ह्यू स्टार्ट केला तर तुम्हाला दिसतील सगळे.
Gallery view, तो कसा करतात?
वरती तुम्हाला पार्टिसिपंट प्रोफाइल जे दिसत आहेत ना तिथे तुम्ही
गॅलरी व्ह्यू ला जाऊ का?
गुड मॉर्निंग सर.
गुड मॉर्निंग, नमस्कार.
अमोल सर आलेत.
हाँ जी, नमस्कार. So basically, this has been going on, as Trupti madam has said, for last 18 months, and this is like every monthly first Sunday meeting, the number is rising. And we have had so many dignitaries from IP and AHA, and and every time we choose a different topic of genuine interest and concern. Concern is more important for the practicing pediatricians. And this time we have chosen three beautiful topics, although the topics are rather ugly, I would say. you know. The third part by Dr. Nishikant Kotwal from Nagpur is very, very important, very preventive, I would say, and remedial also. The first part is the natural concern of all teenage, or rather early teenage girls, vaginal discharge. They take the mid-cycle whitish, pearly white discharge also as abnormal, and they are all the time thinking about it. And now, because of this social media and other peer pressures and all that, they do nasty things which definitely give rise to abnormalities in the normalcy. So that is one topic given to Sukanya madam. And second talk is by none other than my very old friend, more than 25 years, from Gwalior. And now she is a grandmother, although she doesn't look like one. She looks more like a mother only. Of course, she is. But then she is going to highlight us on the important aspects of POCSO, vital for the practicing pediatricians. And the third topic is by the Nagpur chairperson of our IIP Maharashtra and AHA Maharashtra, Dr. Nishikant Kotwal sir, who is a very experienced person in this field. And now I request Trupti Mahatma to conduct the session further. Thank you so much.
Thank you so much, sir, for your word of blessings. So before we proceed, we have Dr. Amol Pawar, sir, Secretary General Maha IIP. I request sir to give his remarks over the program. Dr. Amol
Always
Pawar.
driving, always driving. I don't know whether he runs Ola or Uber, I don't know.
Thank you, Dr. Trupti, and welcome Dr. Rashmi Gupta ma'am, Dr. Nishkant Kotwal sir, Sukanya ma'am, for welcome and thank you for accepting to be there as our speakers for this month's session. So, as you all know, this is very well conceptualized by Dr. Atul Kanikar sir, and he has that acumen of selecting the various topics and speakers also, and Dr. Trupti Mahatme, Dr. Sulva, Dr. Reena Rathi ma'am, and all the youngsters of Nashik AHA, they are helping him out in conducting this program. So welcome again to all the delegates. Already Atul sir has told us about the topics and the speakers. So again, I welcome all the dignitaries from various parts of India. Executive board members from Goa, Dr. Sushma Kirtani ma'am is there, and various others under the chairmanship of Dr. Geeta Patil ma'am this year, Central AHA has been doing wonderful job, and Nasik has been assigned as a place for AdolesCon. So Nasik is holding this year's AdolesCon 2024 in the month of this month only, this month end from 27th to 29th. So I appeal all the delegates, PG students, and faculty to submit their abstract and to come and enjoy the hospitality of Nasik IAP and Nasik AHA. So welcome to each one of you again, and wish all the delegates happy learning. Thank you. Thank you. Over to you, Trupti, please.
Thank you. Thank you so much, sir. So let us begin with our first session. As Kanikar sir has already discussed, the symptom of vaginal discharge always creates diagnostic and therapeutic dilemma in pediatrician's mind. Whether it's physiological or pathological, whether it's bacteria or fungus, should we treat or should we not treat? Our mind floods with such kinds of confusing questions. So to answer all our queries, we have with us Dr. Sukanya S. Madam from Coimbatore. Madam is adolescent health pediatrician from Ganga Women and Child Center Hospital, Coimbatore. She's speaker in various state and national conferences. Her special area of interest being mental health care and nutrition in adolescents and children. Over to you, Dr. Sukanya, ma'am.
Thank you, Tripti ma'am. Good morning, everybody. Good morning, all the faculty members. I thank Maha IAP and AHA Nashik for giving me this opportunity. Yes, can we start, ma'am?
Yeah, please.
Yes, sir. Thank you. The topic allotted today was when to intervene in a vaginal discharge among adolescents. This is a much sensitive topic, and more than that, as sir told, it is kind of dirty, and the adolescents are little shy enough to tell their parents, and more often they consult their peers, and as a result, it leads to a lot of mismanagement and embarrassment among themselves. So this I would like to focus on when to intervene, which is normal, which is abnormal, etc. Good morning, all. I am Dr. Sukanya. I am a practicing pediatrician and adolescent physician from Coimbatore, Tamil Nadu. First, I would begin with physiology, as basics are always basics. The vaginal discharge, it is composed of the endocervical gland secretions as well as a transudate from the vagina, and it is composed of leukocytes, microorganisms like the doddeline bacillus, which starts to colonize the vagina right from 15 hours of birth and also from the parturition also, and desquamated cells. This vaginal secretion, it is bestowed upon the young girls and women as a defense mechanism against the infection and inflammation in that area, because of the acidic pH and the secretion, it serves as a natural protection against all these things. So I my presentation in the form of the first case. It was a 10-year-old girl, Miss A. She was brought by her mother as she noticed soiling of the clothes.
Sorry to interrupt you, ma'am, but your slideshow is not moving ahead.
And the voice is also breaking. Voice is also breaking.
Is it fine now, sir?
Yeah, better now.
This 10-year-old girl, she was brought by her mother as she noticed soiling of the clothes for the past 4 to 7 days. Upon history taking, the color was transparent white. There was no itching or foul smell. There were no regional ulcers. There was no associated dysuria or pruritus. The mother had dewormed her in the past month. There was no suspicion in the mother regarding abuse. There was no history of any chronic antibiotic intake, no family history of diabetes, etc. On examination, she was a thin-built child with there was no pallor. The systemic examination was normal. On visual inspection of the introitus, we could see there was no visible discharge presently. There was no disruption of the normal anatomy, as well as the perianal area was normal. Urine culture was requested and it came out as no growth. The diagnosis is leukorrhea, which is the increased normal vaginal discharge commonly seen in prepubertal adolescents as well as in middle adolescents. The vaginal discharge can be classified into two types, physiological and leukorrhea, as well as pathological. Physiological discharge and leukorrhea they have a thin line of difference. That is, leukorrhea means it is an increase in the secretions causing discomfort and presentation to the OPD, whereas the physiological discharge, it might not soil the clothes, and many a times it might escape the attention of the young adolescent. Whereas pathological discharge, it can be classified into two types, specific vulvovaginitis and non-specific vulvovaginitis. The vaginal discharge, it is a common complaint of vulvovaginitis, and if it's very severe and recurrent, it might be associated with other symptoms like pruritus, discomfort, emotional issues because of the constant stickiness and unable to focus on her daily activities. Second case, it is a 12-year-old Miss B. She was brought with complaints of increased discharge noticed for the past 2 weeks. It was associated with dampness and itchiness, and she had a sticky feeling all through the day, which was disturbing her school activities. On history, dysuria, sexual contact, foreign body, everything was negative. And she also says that she always wears tight-fitting jeans and tight-fitting inner garments to school. And she was also using chemical washes on a regular basis in 1 month upon suggestion by a friend. And she has not yet attained menarche, and there was no other similar complaints in the past. Systemic examination was fairly normal. Upon local examination, we could see a brownish white discharge, and a mild erythema of the vulva was also noted. There was no disruption of the vulval introitus, and the perianal area was normal. The diagnosis leads to a non-specific vulvovaginitis. Non-specific vulvovaginitis, it is the most common cause of vaginal discharge in post-pubertal adolescents. 70% of the cases are attributed to non-specific ones. The causes may be poor perineal hygiene, tight clothing, use of irritants like detergents, cosmetic, not properly washed clothes with detergents, soaps, chemicals, etc. And if it is on a chronic period, we can consider chronic infections. Case 3. It was a 14-year-old Miss R, complains of foul-smelling vaginal discharge for 2 weeks, and the color varies from dirty white to yellowish green. This child, it was associated with pruritus, and she attained menarche 1.5 years ago. She had regular cycles and have used occasionally tampons and menstrual cup. So, coming to the specific vulvovaginitis, the causes could be infections, malformations, or infection. It is the etiology list is very big, but the most common things we see are the infections. Bacterial, fungal, and parasitic infections are possible. And amongst the infections, the candidal infection and the Gardnerella vaginalis, they are the most common causes. And malformations, it could be labial adhesions, vaginal cysts, and clitoral synechiae, though these might be seen a little younger age groups. And inflammatory causes like lichen sclerosis, planus, lichen simplex chronicus, psoriasis, and dermatitis, which could be contact or allergic dermatitis. So coming to the important part, when to intervene. First, we have to classify whether we are dealing with a normal physiological one or a pathological one. If it is physiological leukorrhea, we have to get detailed history regarding all unhealthy sexual practices like masturbation, which is very prevalent among the pre-pubertal children. And once we identify and we are diagnosed, it is only leukorrhea and nothing pathological, then we can counsel the child about the physiology of the normal vaginal secretions. Like they might occur once in a while. It is a small quantity. It is due to the hormonal changes, which is a part of the growing process, and there is no need to be embarrassed about it. We can very well tell her mother, and if it is very much disturbing and soiling her clothes, she can start to use things. So we have to take this point with a pinch of salt, because if we have to start using liners and pads, then it goes in favor of more non-specific vulvovaginitis and not leukorrhea. So that thin line we have to identify by a detailed history taking, and we have to educate her about the vulval hygiene. The tips for vulval hygiene are avoidance of the use of irritants like wipes, tight-fitting clothes, scented detergents, bubble bath shampoo, and we should advise the child that before bedtime she should void properly, and while voiding she has to lean a little bit forward and void so there is no pooling of the urine in the lower vagina. And after voiding, she has to wash the area and dry it with a clean towel, and preferably she can sleep without her undergarments in long nightgowns or pants and t-shirts. And if there is constant irritation and still the discharge is continuous, we can advise her to clean the area regularly on a daily basis with warm water, similar to a sitz bath, for 10 to 15 minutes. And whenever she is cleaning the area, it's preferable to stand and then clean the area, and air dry or gently pad dry without scrubbing with harsh towels. Regarding specific and non-specific vulvovaginitis, we can come to a conclusion whether it is infectious or not based on the color of the discharge. If it is associated with any smell, associated itching, look for perianal area for any excoriations or eggs or visible worms. And to rule out the inflammatory conditions, the area, vulval area, should be examined for any scales, erythema, hyperpigmentation, hypopigmentation, for congenital malformations as discussed above. And last but not the least, the presence of a foreign body should definitely be checked. And investigation wise, if the parents are very anxious and they are very much want to get to the bottom of this, we can do a complete blood count, which will confirm the presence of infection, and a urine culture to see if there is any growth, and because of that there is the irritation, or if there is no culture, we can counsel the parents again. The microscopy of the secretions, it is a two-edged sword, I would say, because examining internal examination of a unmarried woman is not possible, and it is little uncomfortable. But in this era of Gen Z, where the sexual contact begins very early in adolescence, we are tempted to do a microscopy along with the help of a gynecologist. And once identified, we can treat the cause with antibiotics, antifungals, antiparasitic treatment, and any local treatment for symptomatic relief. And if the complaints are persistent, even with our initial treatment and lasting more than 4 to 6 weeks, then we can take help of our friends, gynecologist and dermatologist, to rule out other conditions. Last but not the least, the recurrent vulvovaginitis, recurrent vaginal discharge, which is foul smelling, which is causing local ulcerations. We have to think about sexual transmitted diseases, child abuse, and rarely pregnancy also. We have had a few of our girl patients who had outings on a school trip, and then when all the complaints were assessed detailedly, we were found that they were pregnant. So that also has to be kept last but not the least. Take home messages. The first thing it should be that whether we should identify whether it is physiological and pathological before getting the help of our gynecologists, and proper counseling and emotional mental support should be given to the adolescent. They should be ensured that this is nothing abnormal. They have to take care of their self properly and consult everything with their parents and discuss. And if at all something is disturbing them, they should open up and come and tell to their parents. Vulval and perineal hygiene should be emphasized on a regular basis. Thank you.
Thank you so much, Dr. Sukanya, for such an enlightening talk. Any questions audience has can put in the chat box. Kanika sir, your expert comments.
Madam, actually I had questions, but then if you allow me, because Madam has finished almost 5 minutes earlier.
Yeah.
So, Sukanya madam, it was really a very great talk, very
Thank you
enlightening,
so much, sir.
very well classified into pathological and physiological. And I have few questions.
Yes, sir, please.
One is, what type of discharge do you expect in case of foreign body insertion, which is very, very much on the rise in teenagers?
Sir, foreign body insertion, it can vary from brownish white to if it is infected with the staphylococcus, streptococcus, or any parasites, it can vary from brownish white to greenish white based on the infection. And if it's only the irritant discharge, it can be brownish white, sir.
Okay. And about the use of tampons, which was there occasionally in one of your cases, there is something called a septic shock syndrome.
Yes, sir. The use of tampons is not regularly recommended, but among the children, adolescents, where they like to explore and experiment new things, and so
Or
that's why she was
whether
using
they
one.
are in the long journey, like abroad or something, or if there is
Yes.
menorrhagia, then many girls prefer to use tampons instead of pads. Okay. Second, third question, what I had in mind is in case of sexual abuse,
Yes,
uh,
sir.
type of discharge do you expect?
So, curdy white discharge, it can cause candidiasis because of the disruption of the local pH and the local environment. The child is prone for candidal infection, so we can expect a curdy white discharge, sir.
Do you regularly obtain history about the sexual experimentations or sexual partners, penetrating sexual activities in
Not on a regular basis, sir, but if the history is strong, the child is mentally disturbed, and non-specific complaints like that times we try to elicit deeper.
if the child is very shy to tell the history or allow clinical examination, especially the local examinations, what do you do?
So local examination, once our rapport is established, I ask for their consent. Can I see? I can help you better. There will be no one. I will not expose it to your mama also. So can I see? And my experience, many a times the girls allow me, sir.
Okay. And the local examination, the mother can be the best instrument you can use.
Okay,
No,
sir.
she can separate the labia and you can actually see everything that you wish to see.
Okay, sir.
What type of local treatment you have suggested, madam?
So if there are any excoriations because of the chronic fungal infections, we can try local antifungal treatments, sir, along with
Is there any
topical low potency.
specific antifungal that you recommend?
Nothing specific, sir. I'm usually using clotrimazole and it is helping only.
How long?
I give it for 10 days, sir, and ask
How
them to
many,
review back.
how many times a day?
Since the adolescent might be going to school, using it 3 times a day would be an issue. So I suggest in the night specifically and morning if it is possible.
Do you suggest to wipe the earlier applied powder or cream, whatever, before applying the new one?
That I have not told, sir, because it is a long duration gap. So they would have taken bath. So I assume that it should be clean. That I haven't so far said. Hereafter, I'll try to say.
Okay, thank you. And how
Thank you so
frequently
much, sir.
you recommend dewormination, madam?
So for children, I recommend only if they are complaining, that is above 6 years, the school-going children, adolescents, if they are having any complaints, they visualize any visible worms. For children up to 2 years, we regularly every 6 months, starting from 1 year, I tell them.
Any specific personal hygiene recommendations that you have in mind?
Frequent, nothing other than the books recommendations, sir.
Nail cutting is something which I have been recommending,
Okay,
and
sir.
that
Okay,
has
okay, sir.
helped to avoid local abrasions, and personal hygiene is very good in that case.
Okay, sir. Okay.
And that
Thank you.
also prevents worm infestation.
Yes, sir. Yes.
Thank you so much, Sukanya madam. It was excellent. I hope to see you and personally meet you at Nasik.
Thank you, sir. We'll meet you, sir.
Okay.
Thank you for
Trupti
the
madam.
opportunity, sir.
Yes, thank you. Thank you so much for such enriching discussion. So with this, let us move ahead to our next topic. So dear all, child sexual abuse is in India is a devastating issue and there is alarming rise in the situation. It's a major public health concern as every child is at risk of sexual abuse. As the statistic says that 1 out of 10 boys and 1 out of 6 girls face some kind of sexual assault in their childhood. So, to curb the issues of child sexual abuse, the POCSO Act came into action in 2012. Let us understand more about this POCSO Act from today's renowned speaker, Dr. Rashmi Gupta, Madam. We welcome you, ma'am. She is Fellow of Indian Academy of Pediatrics and Maternal and Child Health with over 100 publications and editorial roles. She has been invited as a speaker in various conferences on subjects of adolescent health and medical legal aspects. She is a proprietor of Vatsalya Pediatric Hospital, Gwalior, and also leads a social welfare organization, Mishti Foundation. And for her work, she has received various awards, some of which are Mother Teresa Sadbhavna, International Woman Achiever, Times of India Icon, and COVID Warrior Award. We are privileged to have you here with us, ma'am, for today's session. I hand over the dais to you. Thank you so much.
Good morning, esteemed seniors, colleagues, and my co-speakers, Dr. Sukanya and Dr. Nishikant Kotwal, sir. First of all, let me thank Dr. Tulkanikar, sir, for recommending my name, and also Maharashtra IIP, Nasik IIP, and Nasik AHA, Dr. Ram Gopal, Dr. Mool, Dr. Sangeeta, Dr. Shilbha, and also MMC observer, Dr. Sanjay Goswami, for giving me this opportunity. But at the most, I want to convey special thanks to Tripti ma'am, for not Tripti, Dr. Tripti, for conveying me, for inviting me for this and keeping my moral high till today. Thank you so much. And of course, this PATH program is going very well, and congratulations and best wishes for this program. For this, I start my topic. Should I share?
Yes, ma'am.
Is it seen?
Perfect. Yes.
Uh, My today's topic is protection of children against sexual offense acts, pediatrician's task. We all of us know that India has got 40% population of children. So child security matters a lot for this, for the future of our country. And so the child population. And so we are going with the next slide. But the irony is that India is home of largest child population in the world who are sexually abused too. Not only 40% like that, but it's a home of largest child population in the world who are sexually abused. Every second child is exposed to the heinous crime. 1 in every 10 child is being abused at any given point of time. Therefore, a stringent law was always needed for this. Ma'am. I'm sorry, I'm not able to see my slides.
Uh,
What happened?
is it not moving?
Wait a minute. I'll restart it, okay?
Okay.
Can I
Okay.
restart it?
Yeah, it
Yes,
has.
ma'am.
Now share your screen, madam.
Therefore, stringent law was always needed to protect these innocent kids. The answer to this is POCSO Act, which states any sexual act, consensual or non-consensual, with a child below 18 years is a sexual offense. Recently, Law Commission of India recommended that to reduce the age of consent to 16 years, but with the condition applied. What happened? Today, I'm going to talk on purpose of POCSO Act, magnitude of problem, salient features, impact on clinics and hospital, expectations from pediatrician, and few medical hindrance. Why POCSO Act? The UN Convention on Rights of Child ratified by India in 1992 and proposed to make a self-contained comprehensive legislation to act against child sexual offense. Because of this, studies done by Women and Child Healthcare in 2007, that 50% of children are exposed to the sexual offense. Constitution of India mandated the state to create special laws according to the Clause 3 of Article 15 of Constitution of India to ensure health and security and to ensure the freedom and dignity. Therefore, POCSO Act came up, as Dr. Tripti Ma'am said, it was implemented on 14th November 2012 and it was amended again in 2019, 2020, 2022, 2023 and it was published in Bharat Ka Rajpatra in the year 2012 for the first time, and now it is updated regularly in 2019, 2022, and 2023. Now, what is purpose of POCSO Act? It is given in according to the Gazette of India. It's an act to protect children from offenses of sexual assault. Sexual assault contains aggravated sexual assault, penetrative sexual assault, and aggravated penetrative sexual assault, sexual harassment by gestures, pornography, and to provide establishment for special courts for the trial of such offences and for matter connected therewith and incidental thereto. Here we are concerned. More than 50% of all crime against children is related to the sexual offense, which is maximizing year after year. In 2016, we can see that 106,000 crime was against children, and reaching by 2021, it became 150,000. And out of this, 50% is of sexual offense. Incidence of crime is increasing age-wise, and more juveniles are falling in conflict with law. Here you can see this. And here also you can see the age is also increasing. In this graph, you can see which is the conviction rate. See, in 2003, the conviction rate is 33.2% when the offense rate was low. But in reaching 2021, when this sexual offense is about 149,000, still the conviction rate is 32.2%. See, the implementation part of the POCSO Act is missing. And here we are to help them. Now, the salient features of POCSO Act. Child is anyone below 18 years and Act is gender neutral. Onus lies on accused to prove himself not guilty. Reporting to Special Juvenile Police Unit, local police or Child Welfare Committee is mandatory by institution as well as the guardian. Punishment for admittment of the act is similar to the offense done in person. Police is designated as responsible protector of the child who also inform Child Welfare Committee. Police makes all arrangements for legal procedures and medical treatment. Act empowers Child Welfare Committee to provide support person to the assist throughout the investigation and trial process is best interest of child to prevent re-victimization. There is no time limit for reporting the abuser by the survivor. He can report after 16 years too. Minimum punishment is prescribed and tailor-made. Now, there has been amendment done in 2019 and the punishment is stepped up to the death penalty. POCSO 22 further added natural calamity, communal violence. Year after year, new things are added to it because you know that it is increasing day by day, the sexual offense against women or child, or administering hormone or any other chemical substance to the child to attain puberty. Through order of special court, interim compensation is granted within 30 days, for which not necessary for the accused to be convicted. Immediate payment for the essential needs like food, clothes, and travel has to be done. POCSO Act 2030 added fast-track special courts because the conviction rate is not increasing. That's why in the heaping of these sexual offense cases, that's why this fast-track special courts was set up. In few instances, quashing of the POCSO Act 2012 weakened the legislative intent of the act. This quashing occurred in UP, MP, and even Mumbai. Recently, it happened because the mother said, yeah, they had a pact between both. The opposite party, they made a pact and they vanished up the case, and with the Supreme Court allowed. I don't know why. So this weakens the intent of the act. Now, POCSO Act, Amendment Act 2024 is going to come up. It is going to be published soon, which may decriminalize consensual sex above 16 years of age. It may be coming in few months. Now, offense and punishment. See, penetrative sexual assault. Penetrative sexual assault means penetration by penis or any object or by any organ of the child using for the penetration, and vice versa. If the abuser uh, asks the child to do so, it is vice versa. Asks the child to do so the same, then it is also covers under PSA, penetrative sexual assault, and the punishment is for 10 years. And if the child is below 16 years, the punishment is for 20 years, which can go up to death penalty. It's according to the section 3 and 4 of this POCSO Act published in Gazette of India. Now, aggravated PSA. Aggravated PSA, I will go in detail, but previously the punishment was 15 years. Now it is 20 years or more to the death penalty, according to section 5 and 6. Now, sexual assault is like for touching the private parts of the body of a child by sexual intent, or asking him to do so the same with or without his consent, or asking him to touch any other person's reproductive organs and body with sexual intent. Now, what is aggravated sexual assault? That will also, the aggravated word is mentioned for specific people, which I will mention later on. And here also it has the stringent punishment has been stepped up from 3 years to 5 years, and it may go up to 7 years or more. For sexual harassment of the child by gestures like voyeurism and exhibitionism, and ask the child to do so the same, is like sexual harassment, and the punishment is 3 years or more. In every case, the victim is being paid for the medical expenses and rehabilitation. Now, pornography has also been included in the POCSO Act, and the punishments is 5 to 7 years. And pornographic act with PSA, penetrative sexual assault, or aggravated penetrative sexual assault, the imprisonment is for 10 years, and it could go up to 20 years to death penalty. Storage of pornographic material involving child is also, the punishment for this is also stepped up from 3 to 5 years to 7 years or more, according to the how many times that person is storing. Like first time, he may get a punishment of 3 years. If second time he is caught, he may get first 5 years. And later on, he may have 7 years or more with fine. And then media and institute discloses. If media and institute discloses identity of the victim, then there is punishment of 6 months to 1 year. Now, abatement of offense. Abatement, whoever provokes the child or provokes any other person to do that act, the punishment is same as the offense done in person. An attempt to commit above offense, there is 1/2 of the longest punishment described for the offense. Even if any person attempts this, then also he is going to be punished, and it is going to be the half of the punishment prescribed for that offense. Failure to report or record a case, the punishment is for 6 months according to section 21, which is not applied to child. And if the head of the institute or head of the medical college doesn't report to the police or SGPU or CWC, then the punishment is 1 year. In case of false complaint and false information, the punishment is for 6 months to 1 year, which is not applied to child, but complaint done in good faith, because we doctors sometimes we see victim, see a child with, we suspect that there is a sexual abuse done, then also we can report to CWC, and that because you are doing this in good faith, so you are not going to be punished under Section 19, Clause 7. Now, what is impact on clinical setting? Any hospital, either government or private, cannot refuse to examine or provide medical treatment to the victim of sexual assault, according to the guideline or protocol of Ministry of Health and Family Welfare 2014. No consultation fee or other expenses has to be taken. They do not need or cannot demand a requisition from police or magistrate for clinical management, because if at all examination and medical care are delayed, crucial evidence of sexual offense may be lost or the victim may succumb to her or his injuries. I had inquired about this, but most of the time this CWC people and the Special Juvenile Police Unit, they take the victim, they take this child to the government sector only. Rarely they come to private sector if there is no, even if you complain, there's one or two times I had complained to CWC, but they had advised me to refer the patient and they had asked the name and all, and they went there to the, here Kamalaraja Hospital is there, they went there and they took all history and all, and they proceeded. So they are always helpful to the private sector people. There is no consult. So I told you that because this is a medical legal emergency, so you have to examine, and any delay can, crucial evidence may be lost. Pediatricians have dual responsibility. I put this picture because this topic is such a, like, it's such a banging on head. So I thought a little smile should come on our face. So pediatricians have dual responsibility. Many a times we are first point of contact to need provide comprehensive medical treatment efficiently, because mostly they come to us in our OPD only when they are from good families. So we need to support SJPU, CWC in evidence collection as an expert witness judicially. We need to ensure that the examinations are not more traumatizing than the incidents of sexual abuse. So need to build a rapport empathetically. We need to coordinate with Special Juvenile Protection Unit or police or CWC earnestly. We need to assist in rehabilitation of the child humbly. All this we have to do, but in private sector, sometimes we are not exposed to all that, because usually the CWC people and this juvenile police unit, they take the child to the government sector only. But we need to maintain empathetic conduct, because most of these child are your patient coming regularly to you from years. Now, let us go with a case. A 11-year-old girl, Sheena, came to my clinic with her mother complaining of abdomen pain for a week. For 2 days, she was having severe pain. The mother also conveyed that she had slipped during dance classes. According to heads, she is a calm, quiet, and obedient third child from the middle-class joint family. On head-to-toe examination, relevant findings were that she appeared pale, depressed, and there were scratch marks on her hands. Bruises were also seen in the lower part of the abdomen and perineal region, but there was no frank bleeding. On asking Sheena started crying. Mother was seeing for the first time, and she horribly panicked. After empathizing, Sheena revealed that the regular family dance teacher, whom she was very fond of since childhood, had forced himself on her, later on blackmailed and threatened her. The mother is a simple housewife, too busy with the household work to sit and talk with Sheena, and she had told her grandmother, but she hushed off on the name of shame and defame. So, it is diagnosed as aggravated penetrative sexual assault that is also of chronic type. Now, what is aggravated penetrative sexual assault? Any penetrative sexual assault committed by police officer, member of armed force or security person, public servant, management staff of jail, protection home, observation home, hospitals, educational, religious institute, factories, gang rape, deadly weapon used in the abuse on physically disabled child, female child, and makes her pregnant, inflicts HIV or other severe infection or physical trauma or causes death of the child more than once repeatedly below 12 years. It has been done by relative or in a person who is adopted the child, and he shares same household. He is in position of trust and authority, and during communal violence and natural calamity. And when drugs are administered to the child to hasten puberty, this all comes under aggravated, and the punishment is 20 years or more, or life imprisonment or death, according to the Supreme Court orders. Now the pediatrician task begin. We as a pediatrician needs to balance ethics and law. It's about medical legal insight, how to proceed as a responsible pediatrician, be a responsible citizen, but also be tactful. Never hurt others, but never hurt yourself too. So this is the comprehensive guidelines how to care child of sexual offense by Ministry of Health and Family Welfare 2014, and they have given the document under 10 pointers. The first is mandatory reporting, second is informed consent, third is first aid, fourth is history examination, evidence collection, and then documentation, treatment, and the discharge and referral, and the follow-up. I will go in short about every point one by one. Now, mandatory reporting. Reporting to Special Juvenile Police Unit or local police with help of Child Welfare Committee, you can do. They are very helpful. You should make a rapport with your child welfare committee of your area. It is now because it is increasing and we have to be proactive in these cases. You may dial 1098 and you can dial 1-800-599-1480 for assistance too. This number has came up last year only because 109 is mostly sometimes it doesn't work. That's why. Why reporting is beneficial for pediatricians? Police protect doctors for consequences. See, you need to report because they may do hangama and at your clinic. So that time the police protects you because sometimes you refuse to examine these children. Sometimes you try to refer these kids, or sometimes you say there is something wrong. Then also they panic. So police always protects you. Police can also help to refer the case to higher medical center. You can tell them you don't have enough uh, capacity or experts in your hospital or clinic, so they can make arrangement for that. The accused may become a chronic abuser, harmful for the society. This is your mental status or mental heart which says to you that yes, you should get this abuser caught. Now, counseling of family about the limit of confidentiality is very important. Whoever knows about the incident is liable to punish by the law for non-reporting. Okay, you can counsel the family and tell him कि we need to report, otherwise you may also go to jail, and myself can also be jailed if you don't report. Or you can just call CWC because limit of confidentiality you have to tell them because it is a duty to inform the police or CWC. CWC people are very helpful and they show you the path how to move forward. Explain to them about child-friendly process of CWC. Prior to POCSO, the innocent survivor had to encounter various authorities separately. See, this is the survivor or the child which has been abused and it has to face so many accused also she has to face judge, lawyer separately. But after POCSO, what happens? The hospital once the you calls SGPU and CWC takes over the case and he appoints a support person for this uh, child and for the mother, and there is a counselor also appointed, and this mother and child, they do not have to face the accused any moment, and even the lawyer of the accused cannot cross question to them, and magistrate, inspector and judge, they sit behind all the procedures go under a camera. Only one special public prosecutor, they do like this, that the person should be mainly a woman, so there's no much distress for the mother as well as the child. Now, seeking informed consent, counseling of the family for the medical examination and evidence collection. If child is below 12 years, then consent taken by parents or guardians, otherwise assent is considered up till 18 years. So we need to, in case of parents or guardians not present or any other reason, the senior doctor of the hospital administration or CWC working in the best interest of can give consent. If the survivor or guardian denies, then refusal of the consent has to be documented carefully. Consent form has to be signed by survivor, witness, and examining doctor. Now, the first, in case of life-threatening condition, shock and profuse bleeding, a pediatrician can provide first aid treatment without consent as per section 92 of IPC. That you have to do. You are mandated to do this. And then only CWC can help you. Now, history taking, date, time, and location of the instances to be noted. Who is narrating, the survivor or informant? That is also very necessary to note down. In the survivor's own word is very important in the court of law. Take relevant medical, surgical, menstrual, and vaccination history. Recent sexual violence history is to be consistent and clear. Difference between negative and not so sure should be recorded, because in court of law, if the once the child says negative, then this pointer can be taken by the abuser in their favor. So not too sure, you have to record it. Now, only female examination. Only female doctors can examine a girl child victim according to POCSO. Document proof for the age of the child is okay. General examination in general mental status has to be seen. Orientation of space and time is to be assessed. Head to toe examination has to be done. Specific examination of injuries and genital organs has to be done. Careful medical examination has to be done to differentiate between chronic and acute abuse. Like in this case, there was no frank bleeding, but there were signs of chronic abuse. Now, evidence collection. All medical centers should have safe kit. Date and type of evidence collection should be mentioned. All clothing and swabs should be air dried, preserved for semen, bloodstain, paint, nail clippings, loose hairs, and others. DNA evidence is crucial and comparative evidence. The evidence needs to be reported within 24 hours of reporting. But if you are not confident enough, then proceed forward. Otherwise, refer tactfully with help of child welfare committee, but maintain empathetic connect with the child and family. So empathetic connect you should maintain throughout it, because this child may be coming to you since his birth. Same as safe kit, it's a box with labeled safe kit and it has got 32. I'm not going to detail in that. You can take it from the net. And if your clinical setting is not equipped with this requirement or experts in this field, better tactfully refer to the higher center with the support of Child Welfare Committee. And it has been done. Here also, I had a talk with Child Welfare Committee person here, and he said, yes, you can, but you need to report. Now, documentation. Documentation is to be done in 4 sets, one for SJPU, one for survivor, special prosecutor, and medical examiner. Here, you don't have to create a set for the abuser. Reasoning of the opinion is utmost importance in court of law, as a doctor is considered as a expert witness. So you should mention, if a doctor don't find any signs of abuse, then you can write like this, that absence of injury and negative lab report may be due to inability to offer assistance, delay in reporting for examination, activities such as urinating, washing, changing clothes, use of condoms, or vasectomy may have done this thing. The negative report is coming because of this. Signature and sealed envelopes has to be handed over to police within 24 hours. Blood and other samples should be refrigerated till handed over to the police. Now, treatment and referral. Treatment of injuries you have to do in your clinic. Prophylactic medicines for pain and infection you can give. HIV prophylaxis within 72 hours of incident has to be given. Emergency contraception within 72 hours of incident has to be done. If urinary pregnancy test, STI test, HIV test has to be done, and you need to administer DTaP hepatitis B vaccine. In case if you need to refer this child in case of for the age estimation when they don't have any documentary proof, and then if there is for fracture, surgical condition, and if urinary pregnancy test is positive and the child is above 14 years, With threatened abortion, you need to refer to obstetrics and gynecology department, and psychological counseling is must. During discharge, assess psychosocial well-being and counsel, assess suicide ideation, and refer or take help of the psychiatrist. Help the family with a safety plan in case of same household share or neighbor. So you need to tell the family to take care of their child so that when they go out and they are not staying with that person around until he is jailed. Explain to them all about child welfare committee and the legal rights. Follow up. You need to maintain empathetic connect with that child, even if you refer that child. We need to be proactive now in these cases. Now, psychosocial care of adolescent. The crisis intervention. It's an age of turbulence. They are reluctant to talk to parents. Confusion about contraception and sexual relationship. Fear of contracting infection. Re-emphasize to them assault is violation of bodily integrity and not honor. Assault is abuse of power and not the act of lust. Tell them sexual abuse, assault has nothing to do with your personality or style. Provide safety plan to prevent reoccurrence in case of near relative or known to is a preparator. Encourage to carry on his or her normal duties. Do not be overprotective. Respect their freedom. Now the medical hindrance. Medical fractures of health professionals of and a hospital is like that. They just felt uncomfortable in examination. More than half could not recognize clear evidence of chronic sexual offense. More than half could not identify major part of child genital anatomy. Untrained doctors may overdiagnose or miss crucial findings of sexual offense. Not every hospital has a team of experts in safe kit. DNA examination as substantial evidence of accused is exceptionally relevant in court of law, but in India, DNA database of criminals are not available, so whom to compare? So this is the study done by Osmania Medical College, Hyderabad in 2023. You can see that only 30% of MD, MS people have got knowledge about POCSO Act. And super specialists, so they don't have, see, they have below 5% of knowledge and MBBS below 50%. This is the fact about the medical person who know about the POCSO. They know POCSO Act as a word, but they don't know how to deal with it and the gravity of it. Dilemma as a IP adolescent severe. What about consensual sex among adolescents who were not acceptable to the guardians? So the government of India may decrease the age of consent to 16 years in the coming POCSO Act, amended POCSO Act of 2024. What about MTP Act? Can she give consent against her parents' will? Any act related to sex is offense below 18 years. What about child sex play due to curiosity? Teenage infatuation due to hormones, which could be manipulated by adults. What about the status of male child in juvenile justice court? You know that this juvenile justice court, when a male child comes, when there is a sexual like in POCSO, if a male and female are arrested or they are um, uh, called upon, then male is considered as conflict in law. Okay, and the female is given the protection. Okay, this should not be there because they are common partners in this consensual sexual activity. So both of them should be in one roof. So, but the positive notes recently have come, I have told you before also, Law Commission of India, September 2020 recommends amendment in POCSO and JJ Act to reduce age of consent of sexual activity among age group 16 to 18 years, considering other favorable factors in best interest of teenagers. It's not like directly they will give the excuse to the male partner or the female partner. Now the only the male partner is to be blamed. That has to be taken care of by the adolescent saviors. Take a point. It's a medical legal emergency. There is pressing need of systematic training of doctors to prevent and detect and respond to ensure multidisciplinary and comprehensive care. Team up to defend ourselves from the judiciary system. That is very important. But recently I have found out that CWC people are very helpful and they are a prominent person from our city only. So whenever you call, they do reply. Failure in prompt reporting, proper recording, and providing efficient treatment, that too free of cost, is a punishable offense under POCSO Act 2012 and Criminal Law Act 2013 and 2018. We need your help. Let's make a difference together. Thank you.
Thank you. Thank you so much, ma'am, for in-depth and very, very enriching and informative session. As madam has already projected the big knowledge gap among healthcare professionals about the POCSO Act, I think all the professionals, all the health professionals who deal with children and teenagers should be well versed with the minute points about the POCSO Act. So thank you so much again, ma'am. Any questions?
We have time.
Yes.
Okay. Madam, I have one simple question for you. As you take the swabs for a girl child, for a boy child with recent sexual assault, what type of swabs would you collect?
Actually, I'm in private sector, so mostly I do refer these kids with if I suspect child sexual abuse, mostly I refer these children to the government sector. I'm telling you. So I think I haven't gone in detail of this because I have never collected a swab, and with the help of Child Welfare Committee, I have referred these cases to the government hospital. I'm sorry for that answer.
No, it's okay. The thing is, basically, the boys mainly are abused anally or orally. So it is recommended if it's a recent episode to collect the evidence from these particular areas, especially the swabs for sperms and all that. So
Yeah.
that is very, very important. Okay.
And they should be collected within 72 hours because they die off. There's no use of collecting after 72 hours of
Do you
this.
recommend that all the hospitals or clinics should have this particular kit, safe kit or rape kit, whatever you say?
But seeing recent things, we think that basic things we should have, like first aid kit, we can have, we can provide all this. And then evidence collection, if it is I think now the time has come that little, not the whole thing, but we can keep some of the thing because we need to be now, we need to be proactive in this case. We cannot wash our hands in these cases. So I think
What if the parents refuse to register a complaint?
if the parents raise, we need to be very we first need to build a rapport with them, and we need to tell them, we counsel them, and most of the time nowadays they are very much like knowledge people, though it's very difficult to otherwise I to report to the child welfare committee. And they asked me to refer these cases to the government hospital. And so there they go and they are handling these cases. So I think most of them are given that measures which should be taken in POCSO Act.
Okay. What will be the first thing that you would do when the child with sexual abuse walks into the clinic?
Actually, they don't come up to me with a child sexual abuse. They don't complain this has happened. They will say cycle se gir gaya tha or something रात को गया था कहीं पे वो गिर गया था, something like that. Or when you are examining this child, they have got those bruises and in their hands and all. And in this case also, you saw that only. The first thing I just come up and sit down and ask them how many members do you have in your family. I will start from there. And then when they say ki, these are the members, how are they? And then you can observe the face of the child. Then it's come up that it's a case of CSA.
Okay.
So
So basically, what happened in my clinic also, I had few cases over a few years, and then all the parents were against reporting. So they said we'll give it in writing that we don't want to report. But still, I immediately called up the local police station, Okay, and the person who picked up the phone, I took his number and Billa number. They have that Billa number. So in the record also, medical record also, I wrote down that Billa number. That this is
Very
the
good.
person I talked to at this particular time. And then he came, and then uh, there was a consent given by the parents. One copy was given to him, one copy was attached to my records. So
Yeah,
then
so
on, I was very, very feeling safe, right?
yeah, police always helps you. I've seen in these cases, they're very helpful to doctors. When you have in a small town like Gwalior, they know you very well, and they take you as a good rapport with the doctor. Like they feel good only that this doctor is have some humanity for the child.
Fantastic talk, madam. Thank you so much. I have heard this at Agra Adolescents.
Thank you, sir. I remember I wore that sari only.
Yeah, and that was
Thank
really very, very good. Over to you, Trupti ma'am.
Yeah, ma'am, there is one more question which we will take. So the question is for practitioners working in tribal areas, adolescent marriage is very common. Should a gynecologist inform the police if the age of pregnant girl is less than 18 years?
yes, of course, this has to be done. But that in that area, many of that doctors, they are in good rapport with those this tribal people. So that has to be considered a little. Like we cannot go abide. Actually, we are human beings. We cannot abide with the law that we are going to harm someone. We know that between 16 to 18 years, this is happening a lot. That's why this juveniles have they are convicted more than the adults. Okay, that's because of this reason only, because that area has to be taken care. So in that time, the little tactful the pediatrician, and yes, they need to report, but sometimes CWC and police help them in these cases. They don't make it a case, and if they find it that it's okay, family is okay. But in big cities, quashing is happening because they take advantage. But in small cities, in tribal area, when it is going with that, so I think above 16 years, um, you have to be a little bit like practical. You're a doctor, you're a human being at last. So you need to be act like that. That like tribal people to police, they go like that only. So I think they should be a little tactful and practical in these cases.
Okay, one last question, if Trupti madam allows.
Sure,
Good.
sir.
You said something about consensual sexual act. So how do you register whether it's a consensual one or a compulsorily made consensual one?
Yeah, that is to be taken care by the prosecutor and Supreme Court. We know that it is consensual. We by counseling them, by talking to them only, they come up like that only sometimes. But the parents, usually the parents are there. They want to help their girls usually because of defaming and all, shame and all. They try the boy has abused or some other reason. Men casteism and all these reasons come up. So that's why it's coming in 2024. This act is going to be amended for 16 years with the conditions applied. Like in Karnataka and all, many cases have happened, and so the conviction rate in the adolescent is very high. It is 87%. ऐसा नहीं हो सकता ना, because only 30. That's why na, it's um, like you have to go with the law. You just report to them that this is the thing, and the work is going to be done by the CWC and SJPU, so Juvenile Justice Board, and they're
Okay.
kept in this no Juvenile Justice House. They are kept there. The Juvenile Justice Act that implies to them.
Okay, done. Thank you.
Okay. Thank you so much, ma'am, for the discussion. With this, we will move ahead with for the important topic handling inappropriate touches. And for the same, we have here very renowned senior pediatrician and adolescent health specialist, Dr. Nishikant Kotwal sir from Nagpur. Nishikant Kotwal sir is chairperson of Maharashtra State Adolescent Health Academy. He was ex-West Zone member, Adolescent Health Academy, representing Maharashtra, Goa, and Gujarat. He is director of ACE Institute, Adolescent Counseling and Education Institute, and Colors Children Hospital and Manorama Children Hospital from Nagpur. Sir is author of the chapter Street Adolescent in Textbook of Adolescent Medicine 2024, and he is also national coordinator for a web-based self-learning module for teachers. Over to you, sir.
Can you hear me?
Yes, sir.
Thank you very much, Dr. Atul, Dr. Trupti, that you thought that I can give some lecture. And so after a long time, I'm giving a lecture. And after hearing Rashmi madam and the other madam, I thought I have a very less material than what they have and the difficult tasks which they are doing. So, but my task is made easier because they have already bombarded with a proper academic knowledge and people need some relaxation. So my topic would be easy. See, I have already made it is handling touch to remain safe. There are so many cases which are occurring, and many a times we are feeling that this could have been avoided had we taken a proper signal of these touches before they went into sexual abuse or anything. Touch is such a wonderful experience and solves so many problems, and that's why we talk of touch therapy also, right? No, next slide, please. Enough of my slide. Okay. The same touch, which is good, a very good feeling, can be bad to adolescent. So let's see which touch is emotionally good or bad or safe or unsafe or inappropriate and appropriate. I don't know how many words we are going to use, but basically it is related to safety, is for sure. From kangaroo care, which is again a touch, we have graduated into touch understanding in adolescence. Girls and boys should be safe is very important. The world should be safe is very important, but it is not. So it's only that if we become wiser, we can save ourselves. Everyone has a different understanding of personal space. The previous one, please. No, the previous one. Agodar. No, you have gone lot of it. Yes. Everyone has a different understanding of personal space. Some people may feel that hug is important, but hug by a stranger is bad. Because unless and until we are very close, we have to keep those space between us. And that is very important. There are specific rules we all follow socially, that which are the areas and parts of our body which are beyond touch for anybody, except few, of course, the exceptions are there. And we not only don't touch our parts in public, but we don't allow other people to touch those parts also. Next slide, please. So these are the areas which we normally cover are my private spaces, which are to be only touched by me, by my parents, or by doctors in case it is needed and when somebody is around with me only. Next slide, please. We not only don't touch these parts, but we don't expose them in front of others also. This is a very important thing. I think nowadays we have to tell the adolescents that do not expose these things in front of others, because exposing them in front of others also can come under law. We talk about these parts only with our safe adults. Supposing you have some problem in these parts which are covered, we only talk with safe adults. Safe adults could be parents and doctors only. We do not touch each other in these areas apart from these areas which you have seen, which are covered, I am telling you, mouth is another area which is supposed to be taken as a most dangerous area and should be kept safe. We should not allow even others to touch our mouth, our lips, or anything. Next slide, please. There are certain situations and touch which we always find to be safe. A girl is going to school and her father gives her a hug and goodbye. And the girl expressions are happy. That is a good touch. So it's the happiness, unhappiness, comfort and discomfort which would determine safe, unsafe, understanding also, and safe and unsafe situation also. A group of boys in school, because nowadays the girls and boys can play together in a game of tag. If they tap on the shoulder of the girl, then, and the girl is smiling because it is the rule of the game, then we call it a safe touch. You can see the next slide, please. We can see that the doctor is examining and the mother is looking. And this is the way the doctor is examining the child. It's a very safe place, very safe way of examination also. And look at the expression on the mother's face. She is happy that the doctor is examining properly. The next is that the boy is congratulating the girl, or the girl is congratulating the boy. They are holding hands. It is safe touch. Next slide, please. A boy walks in hand with a girl, a boy with a boy, or a girl with a girl. Whenever they are walking on the road and they are smiling, happy, comfortable, then it is a safe or appropriate touch. The next, the girl is crying and her friend is giving her a hug. He may be boy or a girl. But if the girl was previously crying and this is happening, it is a safe touch, because we have to show empathy, sympathy, and care also. A girl hurt herself and the boy is putting arms around her. It could be chance taking, but then the expression on the girl's face would show us whether it is safe or unsafe. And I have told you about the doctor's touch. Next. Next, please. Is this a safe touch for audience? Yes, it is safe, because you can see from this picture, everybody is keeping a space in between them. They are putting the hand at the appropriate place, and this is what usually boys and girls they do when they are waiting outside the rest area. Next slide, please. What is unsafe? This is definitely unsafe. A girl is going in a bus and the boy is trying to touch the girl's chest or trying to touch her private parts. This is never to be allowed and is to be taken as a signal of danger. How to take care of it, that we will come to later. The group of boys surround a girl in a park and take turns in, and the girl is in hugging and the girl is uncomfortable. It's a bad situation. Kissing in public place, putting hand on boys' trousers or girls' skirts is a very unsafe thing, inappropriate thing to do. Lifting girls' skirts, adult tries to touch a girl or a boy in his private parts is never to be allowed. It's bad. Now look at this picture, which I have sent. Next slide, please. There is an adult, there is an older person, and there is an adolescent. All the three pictures will show that this is not to be allowed. It is always unsafe, whatever the age of the person may be, whatever the relationship of the person may be. Next slide, please. As I told you, lifting a girl's skirt is very unsafe. And see this second picture, in which you can see the girl is not very happy. The person is inappropriately touching and holding the girl, and this is unsafe. It may be from our own people. So, whenever such things happen, we have to remember and tell children, my space and my rules. Respect my body as my space, which is totally private. Yell if someone is hurting and touching you inappropriately. Say no to anything which makes you feel uncomfortable or which is sexually violating. Run away to a safe place if you can quickly do it. Next, please. This is very important because there are predators in the society. There are predators in our family relationships also. And these are the ways and means we can make ourselves vulnerable. Never keep gifts a secret, because if it is from parents or from close ones, it is okay. Do not keep secrets that could harm you or someone else. Do not trust a stranger or have secrets. Talk to an adult whom you can only trust. This is very important topic which I would like to say a few words if Dr. Atul allows me, or Trupti allows me. Can you?
Sure, sir. Please go ahead.
Yeah. See, we all are adolescent counselors are talking with each other what should be safety. But the girl should be safe. The Badlapur incidents has really highlighted that the school did not take proper care, proper responsibility of safety of the child. We always cry when their crimes occur. But should we not be more alert and see that the school's responsibility about the safety of the children has to be taken as on priority? Because the Calcutta incidents, I don't want to talk about it, but it is only because many did not yell for help. The whole thing went like this and ended like this. I think in any of the thing, prevention is better than cure. So I'm just limiting my talk to touch, but I think even in medical colleges, in our medical college and hospital also, the safety audit has not been taken in any medical college in India. The Kolkata incidents we only talk about, but in my government medical college, I don't know the dean whether he has taken a safety audit also. I think that is the way we should be acting. And that is why this importance of safe touch, a touch and a knowledge of touch, importance of touch, understanding the touch can prevent many, many crimes occurring and save many girls. And now, as I know the statistics, the boys also. Thank you very much.
Great. Fantastic. Fantastic, Nishikant.
Thank you. Thank you so much, sir, for such an important session. Any questions from the audience?
I have one comment to make, Trupti madam.
Yes, sir, please.
Naturally, as a God's gift, I would say, girls and women are very much equipped with the identification tools and knowledge about the, illegal or untidy thoughts of the predators around them. but the boys are innocent. On the top, they have their male ego. हमको कुछ नहीं होता, हम किसी को नहीं कहेंगे and all that. So that's why the boys' sexual abuse is more concealed. But the girls can at least talk to the parents or the mother or mousy or whatever. But here also, again, pathetic situation is that the home people want to hide these particular types of assaults, especially if it is coming from the authority in the house, like, uncle or grandfather or something. So, especially in the village settings, they marry the girl to some other guy away from the house immediately to get rid of the issue. Forget about that is very, very tragic. So, over to you, Trupti.
Yes, sir. Thank you so much. Uh, with this, before we conclude the session, I would like to thanks all the speakers, Dr. Nishikant Kotwal sir, Dr. Rashmi Gupta madam, Dr. Sukarna ma'am, for the enlightening sessions which had made the session successful. I would like to thank Office Bearers, Maharashtra State IIP, Dr. Ram Gopal Chijara sir, President Maha IIP, Dr. Amol Pawar sir, Secretary General Maha IIP. I would like to thank Dr. Atul Kanikar sir, who I already told that is a pillar of the PATH program. He's a chief PATH coordinator. I would like to thank Dr. Sulbha Pawar, who is my colleague coordinator for the PATH program. I would like to thank Dr. Gosavi sir, who is today as an MMC observer. And in the end, thank you so much for all the delegates for making today's session very, very successful. We have around more than 200 participants today. And in the end, Dr. Pallavi madam, for your excellent technical support. So before we stop, I request everyone to please switch on their cameras to have a beautiful group photo.
काय तृप्ती मॅडम तुमचं सगळं लगेच ऐकतात तो लोक खटाखट. He is the commander of IIP.
Yes, yes. It appears everybody has suddenly.
Sir, everyone is fond of taking their photos. Thank you. Thank
Yes,
you.
हरेक को अच्छा लगता है ना.
Yes. So all the beautiful faces are here. Thank you so much. And before I stop the screen, I again appeal everyone to please register for the 26th National Annual Conference AdolesCon, which is happening in Nasik on 27, 28, and 29 September this month. We have excellent academic program which will definitely change your practice, your attitude of practice towards adolescence. We have pre-conference workshop also, which are useful for not only for pediatrician and adolescent health specialists, but also for teachers, for counselors, and many other who deal with teenager care. Thank you so much, everyone. For further details of the conference, you can contact me or anyone from the organizing committee.
There is a very interactive peer education school program also on Thursday. So I suggest those who are interested in family life education in schools and colleges should come and join that program. Thank you so much. Great.
Thank you so much. Thank you.
Bye.